Hafa Adai, buenas and good morning. The Committee on Health, Land, Justice, and Culture is now called to order. Today is Wednesday, January 19, 2022. The time is 9:05 a.m. Notices for this virtual public hearing were published in the Guam Daily Post on Tuesday, January 11th, and again on Sunday, January 16th, and also sent via email to all senators and all main media broadcasting outlets on the same days. The Zoom meeting is hosted by the legislature's AV staff and my committee staff, and the host will mute all Zoom participants until called upon by the chair. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. There are two agenda items for today. Bill number 168-36 sponsored by Senator Telena Cruz Nelson, and Bill number 169-36 also sponsored by Senator Telena Cruz Nelson. I'd like to acknowledge the presence of my colleagues, of course, with Senator Nelson and our Legislative Secretary, Senator Amanda Shelton, Senator Mary Torres, Senator Anthony Ada, Senator Tellaje. Thank you, colleagues, for being here this morning. All right, so we begin with the first agenda item. And I would like to ask that the sponsor of the bill please introduce the bill. Number 168-36 LS. Senator Nelson.
Thank you, Madam Speaker. Bill number 168-36 LS is an act to add a new subsection 41806 and amend subsection 41810 of Article 18, Chapter 4, Division 1, Title 26, Guam Administrative Rules and Regulations, relative to the required registration of prescribers to the Guam Prescription Monitoring Program, Pdmp. The intent of this legislation is to require any practitioner on Guam who engages in the practice of dispensing, prescribing, or administering a controlled substance to be registered in the Guam Prescription Drug Monitoring Program. The Guam Pdmp was established pursuant to Chapter 67, Title 9 of the Guam Code Annotated, which mandates DPHSS to administer the Guam Prescription Drug Monitoring Program to regulate the manufacture, distribution, and dispensing of pharmaceutical controlled substances. On December 26, 2012, Public Law 31-272 was enacted, which established the rules and regulations for the Guam Prescription Drug Monitoring Program. In 2020, Guam had 399 DEA registered prescribers and 24 DEA registered dispensers. And as of May 2021, Guam had a total of 392 unique physicians with a controlled substance registration. However, only 65% are registered to the Guam Prescription Drug Monitoring Program database, and only 31% of all prescriptions on Guam have reports generated from the Guam Pdmp by a pharmacist or by a physician. Currently, the reporting requirements for dispensers to report prescription activity to the Guam Pdmp is for every 15th and last date of each month. This causes a delay in the access to data information. Dispensers and prescribers shall be required to utilize the Guam Pdmp and obtain any prescription information on the patient's history of controlled substances at least every 3 months to determine whether the patient is receiving unnecessary opioid dosages or dangerous combinations that may put the patient at a high risk for overdose. Bill number 168-36 LS is intended to help reduce this misuse, abuse, and diversion of controlled substances. And with Guam's Pdmp, it will ensure the integrity of our island's healthcare community by providing prescribers and pharmacies information on their patients to assure legitimate use of controlled substances. We also introduced in Bill number 6-36, which was a challenge in itself. We had a hearing for that, and this is a supplement to Bill 6. So in Bill number 6-36 had registration requirements, dispensers reporting requirements, access to prescription monitoring information by dispensers, access to prescription monitoring information by prescribers, practitioner prescription report cards, contract for administration by other agency or private vendor, and practitioner patient agreements. So in this Bill 168-36, all we are requiring is the registration requirements. And I understand that there was some concern with our healthcare providers, our healthcare practitioners who prescribe certain types of medication. And so we convened working with Dr. Berg several times and discussing this avenue for just allowing registration requirements. And that was based on the display of DPHSS showing how the web-based program really worked. The concern that it would be too timely to address each individual patient, to report the prescription that our prescribers were prescribing to that patient. However, after showing some of our healthcare practitioners the process, they understood that it wasn't that lengthy as needed. So just as a general overview, and I hope that if possible, that DPHSS can display it, what the web-based program looks like. And basically, it's just a program that you log into as a doctor or prescriber, and you type in the name of the patient, and you just update whatever you're prescribing. And so this helps to track the medications and the dosage amounts that are given to the patients who are seeking pain relief or other substance-controlled items. And so I thank Dr. Rear, Dr. Haddock for being present. I welcome, the concerns that I'm sure you might have. And we're just hoping to bring the community together and see if we can move this bill forward and substitute it on the floor if there are any concerns. And also Ms. Gabriel and Tom, thank you for being here, and Jeff and Ms. Brianna and Gary. Thank you. Thank you, Madam Chair.
Thank you, Senator Nelson. I'd also like to recognize the presence of Senators Chris Duenas and Joanne Brown, who have joined us. Thank you for joining us, Senators. We'll now begin with to accept testimony from those on the panel. I'd like to begin with Mr. Masatomo Nadeau, Chief Environmental Public Health Officer, Division of Environmental Health, DPHSS. Mr. Nadeau.
Thank you, Madam Speaker. Thank you very much. And thank you, everyone, and good morning. Half a day. My name is, I'm sorry, let me do this correctly. Half a day Speaker and Health Chair Therese Telena, Senator Telena Nelson, and members of the Committee on Health, Land, Justice, and Culture. My name is Tom Nadeau. I am the Chief Environmental Public Health Officer with the Division of Environmental Health of the Department of Public Health and Social Services. Also with me is Mr. Jeff Manala. He is a Program Coordinator with the division and manages our Guam Prescription Drug Monitoring Program, otherwise known as Guam Pdmp. On behalf of our director, Mr. Arthur U. San Agustin, we thank you for allowing the department the opportunity to present its testimony on Bill 168-36, an act to add new Section 41806 and amend Section 41810 of Article 18, Chapter 4, Division 1, Title 26 of the Guam Administrative Rules and Regulations relative to the required registration of prescribers to the Guam Prescription Drug Monitoring Program. The Department of Public Health is in support of Bill 168-36. Guam Pdmp, the Division of Environmental Health, is responsible for maintaining the island's prescription monitoring system, which is a database dedicated for collecting dispensation records of pharmaceutical controlled drugs, such as narcotics and other potentially addictive substances that are available for legitimate medical use. Guam Pdmp is able to observe all controlled drugs that are being dispensed by the island pharmacies to monitor the prescribing habits of authorized practitioners and the types and quantity of drugs obtained by patients. Guam Pdmp's database system can also provide authorized healthcare providers a utilization report of their patients. This report details what controlled drugs were dispensed, the quantities, when the drugs are prescribed and dispensed, and the name of the prescriber and pharmacy. Thus, the utilization report can assist the healthcare provider in better treating their patients and to identify possible abuse or misuse of controlled drugs by these patients. To help healthcare providers in that endeavor, Guam Pdmp provides information and training to the providers in requesting and receiving utilization reports. Every year since 2015, Guam Pdmp has received and compiled an average of 49,000 dispensation records from island pharmacies and generates about 11,000 patient utilization reports. Majority of these reports were requested by pharmacists. However, with the passage of Bill 168-36, even more utilization reports will be requested and reviewed, which will improve patient care and further reduce the potential for drug diversion to occur. According to the 2020 Pdmp Training and Technical Assistance Center survey, which is conducted annually by the Pdmp Training and Technical Assistance Center, Guam and 8 other states do not have laws requiring mandatory registration for prescribers to use the prescription monitoring program. Furthermore, many states actually have penalties and sanctions that include fines, revocation, and or suspension of a prescriber's license if they fail to use the prescription monitoring program. This information can be provided at the following website, www.pdmpassist.org. The U.S. Centers for Disease Control Prevention reported that in 2018, of the 67,317 drug overdose deaths that occurred in the United States, about 46,795, which equates to around 70%, involve opioids. Opioids are a class of drugs in relieving pain, such as morphine and fentanyl, which are made from the poppy plant or synthesized in the laboratory. Opioids work by softening the perception of pain and boosting feelings of pleasure in the brain. If abused or misused, opioids can cause dependency to health and leading to health and other crises. Guam Pdmp data reveal that about half of all prescriptions are opioids on Guam. Since 2015, the most prescribed opioid has been an oxycodone acetaminophen combination drug, at approximately 30,000 prescriptions for supply of over 425,000 days. Nationally, prescription drug abuse has reached an epidemic proportion, with an average of 128 people dying every day in 2018 due to opioid-related overdose. Anecdotally, the drug of choice on Guam is still ice, otherwise known as methamphetamine. Nonetheless, past investigations by public health have demonstrated that diversion of pharmaceutical controlled drugs does occur on Guam, and we all must remain vigilant in preventing it from reaching the level seen in the mainland. One of the keys in preventing drug diversion is the use of prescription drug monitoring program by the healthcare professionals. In that effort, Guam Pdmp has conducted numerous trainings targeted to pharmacists and practitioners on the access and utilization of the system and its benefits. However, the number of users remains relatively low. Bill 168-36 will mandate all practitioners to register and utilize the system. This will result in improved patient care and management. Individual practitioners have a professional, lawful, and ethical duty to ensure controlled drugs are prescribed and dispensed in a manner that takes into account the nature of the drug being prescribed, the established medical standards for prescribing such drugs, and that there is a legitimate medical purpose for treatment using these drugs. It's for these reasons provided, the Department of Public Health and Social Services supports the intent of Bill 168-36. Thank you very much for allowing me the opportunity to provide this testimony. Thank you.
Thank you, Chief Nadeau.
You're welcome.
I'm also now going to recognize those from Public Health if they have additional testimony. I know you recognize Jeffrey Pinalla, the Program Coordinator for the Division of Environmental Health and the Manager of the Guam Pdmp Program. Mr. Pinalla, would you like to add additional testimony on behalf of Public Health?
No, my chief gave the testimony that we put together for the department on behalf of the director.
Thank you. And what about Brianna Sablon, Program Coordinator 3, the EMS for Children Program Manager or for the Department of Public Health and Social Services?
None to add, Madam Speaker. Thank you.
Okay, thank you. We'll now hear from Gary Schiff, Patients' Rights Advocate for Guam and the CNMI. Mr. Schiff?
Hello, hello, Senators. I'm wondering, could I request to go later so I could listen to kind of what others say and then respond, or do I need to give my testimony now?
I'll allow you to go later. Called on now, Dr. Carla Haddock.
Hafaday, good morning. I wanted to speak in favor of this bill. Senator Nelson, thank you for listening to us with the changes that you made. I as a prescriber, I am one of the few who I notice goes on the website and actively looks and monitors my patients and their prescriptions. And I can tell you that this database is wonderful. And I thank Public Health for all their hard work with doing the database. I do wish I could be the one to actually go in and enter my information, but as my status stands, I can't actually do that. So Senator Nelson, I didn't know if you were aware, but we probably do need to change that if I'm going to be the one to actually go in and enter the prescriptions that I'm writing. Usually my pharmacists that are dispensing it are the ones who are entering that information. I also don't have the capability to enter in alerts. So for example, if I have people who are on a strict Suboxone program, I'm one of the few that are X-waivered, I can't enter that in as if anyone else is wanting to prescribe opioids or other medications, I would ask that they consult me first before prescribing. So I would like those two changes to the database. Other than that, I support this bill, and I'm glad that we are going to make it mandatory because I think more practitioners need to log in and to view this information to safely provide care to our people of Guam. The only problem I did have, and I don't think it's an actual problem, is when you were speaking was requiring us to log in every 3 months. But when I was reading the actual statute, I believe the mandatory was only every 12 months, or if they're a new prescriber. So I am up for that every 12 months for now. 3 months might be a little tedious, especially with our patient load at the various places that I practice and the sheer amount of prescriptions for controlled substances that I'm writing per day. It might be too tedious for every 3 months, and I don't want to have that fall through the cracks. But other than that, thank you for this substituted bill. I really appreciate your willingness to listen to us.
Thank you, Dr. Haddock. And now recognize Melissa Gabriel from the Guam Board of Examiners for Pharmacy.
Thank you, everybody, and thank you, Madam Speaker. My name is Melissa Gabriel, a pharmacist with the Guam Board of Pharmacy. This is a good bill. I do think it is important that physicians and pharmacists are utilizing the Pdmp to help reduce over prescribing and prevent drug diversion. However, I do think just the wording in saying that engaging in the practice of prescribing and administering may cover many licensees. So I do have a license also out in California, and this was a requirement with their Pdmp as well back in 2016. And so all pharmacists, they have it worded as just licensed pharmacists and persons who can prescribe schedules 2 through 5. This then only has licensees who, just the pharmacists, rather than also including the interns and registered technicians and the certified pharmacy technicians. I feel like saying any person engaging in the practice of dispensing may also include those licensees. And at the end of the day, during our shifts, the final checkoff is always under the pharmacist license, even though there are other licensees under them. And another thing with the persons engaging in the practice of administering, I think this will also include licensing boards to sign up under nursing. And from my, like I said, background with the California one, I've only seen it as the prescribers using it and then the pharmacists using this database. So having that requirement, again, would have to change, we'd have to consult all the licensing boards to have them update, because if we're not in compliance with having the registration, then we shouldn't give those licenses out, or we would have to suspend them. So that's my one comment. And the second question, though, I would have is, of course, after this does become law and having requirements that everyone does have to register, what is basically the timeline to get everybody registered? because we don't want to know, like as a board, how much time should we give all of our pharmacists to register for the PDMP. Also, of course, if we can get that listing so we can make sure everybody is in compliance and they can keep their license after the registration is complete. Yeah, that's all I have right now.
Thank you very much, Ms. Gabriel. Dr. William Weir, you're recognized.
Thank you, Speaker. This bill, I think, is certainly a bill that deserves consideration. Before I speak specifically to this, I'd just finished a presentation on tobacco use and vaping. And it was pointed out that the effects of tobacco use are probably 8 to 10 times worse than alcohol, and we know that drugs are much less than alcohol. The number of deaths that were presented by Mr. Nadal amount to about a sixth or seventh of the deaths attributed to tobacco. It should also be kept in mind that many of the drug deaths that we see are due to illicit drugs rather than prescribed drugs. The figures that come to my mind are about 20% of these deaths are due to prescribed drugs. So we're looking at a problem, but it's much less of a problem than perhaps we recognize, and there are many other areas that deserve consideration. My recommendation, after hearing the preceding testimony, is that this bill be tabled for the time being, and that the legislature set up a roundtable of parties, which I'll describe here. One of the big problems with this bill is reporting requirements. These are very burdensome for practicing physicians, and I think are duplicative in that any prescribed drug that I make is filled through a pharmacist. And we do have a system, it sounds like, in place. I was not familiar with this system. But we do have a system in place, and I think that the pharmacist should be the backbone of any reporting system that we have. In terms of physicians, I was not personally aware that there was a need for registration in such a system. My recommendation would be that if you prescribe opiates and those numbers are known through the DEA registration, that you automatically be enrolled in such a system, and thus have access to any of the information that might be generated. Pharmacists, in my experience, have been very forthcoming with information when requested. And I'm glad that they do have more sources than just me as to what happens with these patients, and can transmit that information to me. In terms of the reporting system itself, again, I was not aware that we did have a system in place. but I'm sure that other states do have reporting systems. And I suspect these are computer-based and there is cost involved. I think it's important that we have funding made available so that if you do implement laws, that there's a system in place so that they can be enforced. Furthermore, I don't see that there are any penalties associated with this law. And I think that that probably needs to be addressed as well. As had been mentioned by the Board of Pharmacy, there are a number of people that are involved here with this law. This includes pharmacists, it includes physicians, it includes nurse practitioners, and perhaps others. And that needs to be addressed. So in conclusion, I would recommend that this bill be tabled for the time being, and that some of the questions that have been brought up be addressed before the bill is brought back for a vote. Thank you for your time.
Thank you, Dr. Weir. Mr. Schiff, would you like to testify?
There we go. Thank you. Thank you, senators. It's nice seeing everyone here. I would thought there would be more physicians or dentists, because this law particularly would impact their practices if they are indeed required to sign up with the prescription drug monitoring program and have to pull the patient utilization report on any new patient or an existing patient that hasn't received any controlled substances for 12 months. Now, we have to ask ourselves, we've had this prescription drug monitoring program in place now many years, but yet, as Senator Nelson mentioned, we only have a small number of prescribers that are utilizing the system. You got to ask yourself why. And I think part of the reason is they understand it's a system that can hinder them providing the appropriate medications to patients that need it. Now, as a patient's right advocate, I believe in the intrinsic right between the doctor and the patient to make their decisions with as little or no input from government agencies. That's always been my position. If this law was to be passed, first you have to get your prescribers on board. And what if you don't? What if you pass it and there's still half prescribers who says, well, I'm not gonna sign up, I'm not gonna use it. Well, what's gonna happen is a patient goes to see one of these doctors and they'll say, well, I can't prescribe you the medication I think you need, but here's a doctor over here that's registered and doesn't mind pulling up these reports. So we're going to have these patients. You can't call it doctor shopping, because they're not shopping. They're just shopping to find the right doctor that will write them, because so many are going to just say, hey, I don't want to have anything to do with this. I don't want a report card from DPHSS telling me how good I'm doing. I've been to school for 12 years. I'm done with report cards. They don't have the time to pull up these reports. And secondly, it can take up to 24 hours to get the results back. So let's say physician, Dr. Weir, you have someone come in and they're they need immediate acute treatment, whether it's a psychotic episode or they broke their leg, they had a car accident, their back, extreme pain, or mental issues. You would have to go to the system, sign in, hopefully it's online and power's not down. Then you'd have to request the information and wait upwards of 24 hours to get the report you need. Now, what's going to happen to that patient? Well, he's going to have to suffer. And that's my concern as a patient's advocate. Now, I also believe strongly that the system we have is working. I don't see statistics where we're seeing prescription drug abuse on the street, people, stealing drugs, overdoses. That's not Guam. There's always a few bad apples. And I know, Senator Nelson, you had an issue in your family, I understand. So it does happen, but we can address those with the tools that we have. The prescription drug monitoring program was set up to have the firewall at the pharmacy. If you go into a pharmacy with a Schedule 2, 3, 4, or 5 medication, they must, by law, access your history and see if you're doctor shopping, how many prescriptions. And if they don't do that, they won't be able to continue to order those drugs. Now, Melissa's here, so she knows much better than me. But I always believe the system sets up the roadblock at the pharmacy. And that's why when this law was originally written, it was mandatory for pharmacies, recommended but optional for prescribers. Again, a patient goes into a dentist. They have a double root canal that's totally infected. Would they want to wait 24 hours before they can get approval to write a prescription? I don't think so. So you can see there's problems wrong. And those that do sign up, if it does become mandatory, they're not going to want to pull those reports. So they may give you, well, just take Tylenol. Even though Tylenol with codeine may be more appropriate, or maybe you have a bad cough, so you want cough syrup with codeine, but that's a Schedule 3 drug, so they'll just give them something over the counter because they don't want to deal with the system. So we're going to get inferior treatments if this is to proceed. And then lastly is the fiscal report. Right now, we spent, the federal grant is approximately $300,000 to support this program. And that grant ends 9/30/21, or started, I believe, 9/30/21, but doesn't take into account for the additional staff that will need to be hired in order to oversee the additions to the existing program. And somebody's got to spit out these reports. Someone has to, monitor the system, deal with it. So do we have the funds? Because it's certainly not in the last federal grant, which is $300,000. So I appreciate you letting me talk. I hope I didn't miss anything I feel is important. I just feel that we really don't have a problem. And until you show me the numbers, I know we talk about a lot of prescriptions and 31% aren't reporting, but keep in mind any opiate prescription, for example, can't not be renewed. So that counts as one prescription, whereas others can get renewals up to 6 months. So obviously it's going to look like a lot of prescriptions. So I think I'll leave it at that. I want to thank you. I'm just very concerned that our physicians aren't on board. And it seems to me the first step is you got to get them to commit to it, or else they're just going to be sending patients to different doctors that will do it. So thank you. I appreciate being here and look forward to the rest of the testimony.
Thank you very much, Mr. Schiff. I'd like to note for the record that we have also received written testimony from Jerry Caruso of the Guam Board of Examiners for Pharmacy, and that the Director Therese Ariola of the Guam Behavioral Health and Wellness Center was supposed to be here. She sent her apologies to me that she had a family emergency right before the hearing, although she intended to attend this hearing. So she will be sending written testimony. We will provide that to all the senators, of course, and on our website. So I will begin, I guess, with the questioning. We have a fiscal note from the Bureau of Budget Management Research for Bill 168-36. Part of this fiscal note describes that that public health stated that the implementation of this prescription drug monitoring program would pose a significant financial impact as the program is funded via federal grants. Public health estimates the cost per fiscal year to manage the program would be approximately $299,171. No local funding has been appropriated to support the staff salary database and implementation of report cards, mandatory compliance tracking. Current grant expires on September 30, 2021. However, funding for the new implementation of the report card feature and mandatory compliance tool is not appropriated in the current grant. I think BBMR was talking, kind of going back and forth between Bill 6, which we are not talking about today, and the current bill. And so they ended with, if the proposed legislation, Bill 168, were to be enacted, the public health's most likely next course of action would be to apply for a federal grant to provide funding for the implementation of the Pdmp program. I hate to say it, but I really can't rely on this fiscal note for some concrete information. So I'd like to ask you, Mr. Nadeau, on behalf of Public Health, what are the fiscal impacts that you expect from this bill? I know when we spoke previously, you mentioned that there was a Department of Justice grant that you would be able to utilize. Could you please elaborate?
Sure. Thank you, Speaker. And also, I'll allow Mr. Pinal to chime in if I misspeak or give the wrong information. So currently, we do have a federal grant through the United States Department of Justice, and it is allowing us to operate the Pdmp program. And just recently, we were awarded a $1 million grant to continue the implementation of the system, which includes also the salary of employees such as Mr. Pinala. In terms of the impact, Bill 168 has, it will just be an expansion of what's already in place. We're simply now requiring, well, we'll be requiring, if passed, the prescribers to register and access the utilization report. It's done, the report is generated automatically once requested. So in terms of the actual operation, the number you stated, Speaker, I think that's probably correct. I think we provided that number some time ago into the entire operation. But to the funding, we had the funding at this time, and we just received a recent federal grant allowed to continue operation. And we made it clear in the past that if there's ever a time where we lose federal funding, we do have the Controlled Substance Diversion Fund. It's a revolving fund. It's a non-appropriated fund that's generated through registration of registrants, like those who prescribe controlled substances. So that is also available for access if necessary. But at this time, we're hoping to utilize that funding to hire more staff to investigate potential diversion. So, but that funding is available if necessary, but we rather use that for the actual enforcement part of the program. So I hope I answered the question, Speaker. So at this time, we do have funding, and we recently got a federal grant, $1 million, to allow the program to continue.
All right, and so you expect to use the funding that you've received to hire more personnel in order to expand the program, or you don't need to hire any more personnel?
It's the reports generates automatically. And Jeff, there is discussion about need for administrative assistance to not simply to run the system itself, but to ensure that the program is, as Dr. Ware has mentioned, he was not aware of the system. So to expand in the sense that provide more education, more outreaches, more training. So that along that line, that's a possibility to seek administrative assistance for the grant. and to continue the operation and pay Jeff's salary as well.
All right, and you agree that physicians should also input information and that it's not duplicative versus only pharmacists?
So I was, as others were making their testimonies to speaker, I was jotting some notes down, and that's one thing I wanted to respond to about is that the pharmacist has been. Let me take a step back. So when I started with the Department of Public Health nearly 30 years ago, the first program I actually managed was the Controlled Substance Program. And one thing I quickly learned was that the pharmacists are truly one of the frontline defenders of preventing diversion. They monitor, they generally know the patients that come in very well. In fact, they knew all the drug diverters on island, which was shocking to me because information shared among the community. So I give them a lot of credit for that. And they were really helpful in preventing a lot of diversion. So in terms of duplicate, it starts with the prescriber. And that's usually the physician. They're the one who writes the prescription. So I can't say that this should be just placed responsibly given to the pharmacist alone. I think this should be a whole healthcare community effort. Everything from the prescriber to dispenser to the public to law enforcement. So to answer your question, Speaker, it was a duplicative. If I understood the question properly, I don't see it as being duplicative having the prescriber and the pharmacist seek digitalization report. In fact, we should even prevent it from even reaching that level to the pharmacist if you just prevent it, because key to all disease prevention is prevention, right? So I don't see how requiring the practitioner to get the digitalization report is actually a burden. In fact, I think anything, it's a first step in preventing diversion. I'm sorry, I went on a whole long tangent there, but I hope I answered the question, Speaker.
Let me see the bill. Mr. Nadeau, so you're saying physicians would only need to utilize or to review the utilization report, not to actually enter information?
Jeff, could you maybe share how the system works since you're more familiar with the operation?
Yeah, so just to clarify, prescriptions that are written and fulfilled are uploaded by the pharmacies. They have it automated. It's fairly easy for our database to collect all the prescriptions prescribed. And the only thing is there is a 2-week delay because of our requirement for uploading that information right now. So that is different from accessing the patient prescription information. That is just as easy as kind of doing a Google search. If you have ever done a Google search, it's automatic. You just log into our database, type in the patient's name and date of birth. Those are usually the two required fields, at least, you need to access a patient's prescription history. That generates a report within seconds. It generates it as a PDF. You can download it, print it out, attach it to your patient records, and view the history that way and base your prescribing on the history you see from the patient on the patient utilization report.
And Speaker, just to further clarify what Jeff is saying, the physician's not the one who's putting the prescription information into the database. That is done by the pharmacist. All the physician would do is simply access the information. And I think Jeff put a good comparison, like a Google search, right? You Google someone's name, a patient's name, and it gives you the history, dispensing history of that individual. The physicians, they do not put the prescription history or the information onto the system. That's done by the pharmacist as it's dispensed, after it's dispensed to the individual. It's just a form of monitoring system that allows the physicians to access information about their patients. They're not doing additional work per se, like they're, compiling the information and uploading it. That's not their responsibility. That's the pharmacist's responsibility.
All right, I wanted to clarify that because it seemed like some people were talking about the physicians having a burden of, getting online and adding that information. Okay, so Are you able to do the training necessary? Is public health able to do the training necessary to implement this program? In other words, to train physicians how to access these reports efficiently, and to get all physicians online, and how much time would you think is needed for that?
Thank you, Speaker. Yes, so we've actually had reached out to the board and the medical society, and we offer training and use and information to access of the system. Granted, it's been some time. We've been preoccupied with other emergencies, so we've definitely, that's something we could get back to, and in fact, we hope to. That's one of the reasons why I think we're seeking administrative assistance to help that effort. But Jeff, do you want to add to that about the training we offered and we plan to do? Also, we also released all CSR, controlled substance registration renewals. There's an attachment to it which informs the practitioner about the availability of training if they so wish to get one. Jeff?
Yes, correct. The training is fairly short on how to use the system, at most 2 hours, depending on questions, but it's a fairly short training. The system is not that complicated to use. And my chief is correct. We do when we send out the renewal letters, reminder renewal letters for the CSRs, we have been including a separate one-page reminding prescribers that there is the system available and training available as well.
All right, thank you. And Dr. Haddock, you were talking about the physicians part of this. If you could expand, if you agree with, Mr. Nadeau, or the concerns that were raised.
Yeah, so there's a couple of concerns. One is the time frame of the 24 hours. There is no, once you log into that database and you run the report, like I said, it's seconds. You can access the database on any web browser via your phone. So it's actually like once you type in the patient's name and date of birth, the report comes in instantly. I've been a prescriber since 2018, and not once has the website been down for me when I needed to access it. So I can say that that is amazing. It took seconds to register for it. I was able to get my username and password within 24 hours after public health went and verified my information as a prescriber. And I was able to get that information immediately upon doing that. In terms of the concerns raised by Mr. Schiff about acute conditions like psychiatric disorders, aggression, things like that, that we need to treat immediately within behavioral health or at the emergency room or acute inpatient conditions, this doesn't apply to that. This is only merely for prescriptions. We don't log in the database when you're using medications acutely in the hospital or at behavioral health, okay? This is only for generated written prescriptions. So I wanted to clarify that misinformation. And in terms of the trainings, honestly, if you're pretty tech savvy or not even tech savvy, all of us access Zoom. I'm sure every practitioner can understand how to get a username and a password to log into the database. It's not rocket science, but I don't think that there's going to be these long, day-long trainings for how to use the database. So once again, I'm going to say that this is a wonderful bill. It's really needed for practitioners to log in and see the information. But I wanted to clarify some of those misinformations as someone who actually utilizes the database on a daily basis.
Thank you very much. I'll now recognize the sponsor of the bill, Senator Nelson.
Thank you, Madam Chair. You actually addressed some of the questions that the individuals giving testimony had, so thank you for that. Just to make it clear, Chief Nadeau, does this come at a cost to the prescribers? Do they have to pay like a subscription fee or anything to be a part of the PDMP?
Absolutely not. In fact, I think they're already making a payment, if you will, through the registration of obtaining the controlled substance registration, the fee. So there's no additional fees in the passage of this bill.
Okay. And does the PDMP prohibit prescribers or other practitioners to prescribe medication to their patients?
I'm glad you brought that up, Senator. This is a system to actually assist the practitioner, the healthcare providers. It's not meant to use as a law enforcement tool. It can be used as such, of course, but it's primarily from a public health standpoint of protecting the patient and to ensure they're not misusing or abusing pharmaceutical controlled drugs. It's a monitoring system, Senator. So the system does not dictate how an individual practice medicine. That's not our business. Our business from public health is just simply to monitor and provide the information as requested, whether it be from the practitioner, the dispenser, or even law enforcement, provided it's a legitimate investigation. It's not a tool to use as a let's go fishing expedition. There has to be a legitimate investigation to access this information, and you have to be registered with us if you're a healthcare provider. So it does not in any way, or should not, prohibit an individual from practicing his or her medicine.
Thank you. And Madam Chair, if I may, Chief, would it be possible if you could do a quick display of what the PDMP looks like, the web-based program?
I just had a discussion with Jeff some time ago, and whether that was possible. And Jeff has shared with me that there might be personal information that's available when you pop it up. So we're concerned
Okay.
about bringing it up. So Jeff, I can confirm that maybe does the website itself, the homepage, is that restricted in terms of, is there personal information there that we should be concerned about?
No, I can show them the website and just the area to access the patient report. We won't generate any reports because, of course, that would show patient information. But I can, if allowed, share the screen and just show the website and how they can access it.
Would that be possible, Madam Chair?
Yes, if the staff could allow Mr. Pinala to share screen, please.
Thank you. Thank you, Jeff. Thank you, Chief.
Just 1 second. All right. Share screen.
Mr. Finale, you should be able to share screen now.
Thank you. Share screen. All right, does everyone see the website?
Yes.
I do.
So this is the website. You can open it again via any browser. It's recommended to use the updated browsers such as Chrome, Microsoft Edge, or Firefox. Try not to use Internet Explorer. That's been discontinued by Microsoft, but pretty much this is your the web page.
Can you enlarge that, Mr. Pinala?
Sure. Yes.
Thank you.
All right, so if you are new, of course, you will have to create an account. But once you create your account, that can be approved within few hours. But this is once you log in with your information, this is your dashboard. It looks a little different for me because I am the administrator. Now to get to the patient request, you just go to menu and patient request. Type in first name, last name, date of birth. Those are the only required information you need. You can type in other information if you need. Once you type that in, it'll generate a report. I can show an example of a test patient report. It's a fake report, no personal information. It's fake. I can share that as well real fast and to give you an idea of what the report will look like. Let me just pull that up. I downloaded the PDF earlier. So once you do collect the, enter the information and you click search down here, there will be a download button up on the top where you can download the PDF, and the PDF will look like this real fast. Let me just share the screen one more time. So this is a fake report. No real information on here, but this is how the report will look like. It gives you, when the report was prepared, the name, any prescriptions, a summary of it, and then a more specific line item on the bottom. And
Are you
then
able to zoom?
prescribers.
Can you zoom in on
Oh,
that
yes.
for a second? Yeah.
Yes, there you go.
Thank you.
You're welcome. So again, this is a fake report, but it'll look similar with a real report. And again, as Dr. Haddock did share, it is generated within seconds.
Thank you, Mr. Pinella. Senator Nelson?
Thank you, Madam Chair, and thank you, Chief and Jeff, for that display. So, Madam Chair, there was a testimony earlier that said it's going to take 24 hours. That's not true. The cost, there's a grant available. There's $1 million already awarded for this program. It's not going to cost our prescribers or our doctors anything. There was a question by Ms. Gabriel about the time of enactment, and that is for immediate enactment once this becomes, if and when this becomes law. That can be changed to something more flexible for the prescribers. If we can get testimony on what would be a viable recommended enactment time or date for the prescribers, then absolutely we will make that change. But I think I believe you and I covered the concerns on the bill so far. So I thank you, Madam Chair, for this opportunity.
Thank you, Senator Nelson. Senator Nelson, can I just ask if, is this intended to be tied to licensing? I've heard
Can you
testimony
make
about
your question a little bit more clear?
is this bill intended that if they do not register, that it will affect their physician's licensing?
Right now, Madam Chair, there is no consequence to not registering. The doctors were concerned that if they weren't able to register, they would be fined or they would be a licensing hold. But that's absolutely a revenue that we can look forward to adding some teeth to this measure, perhaps, suspending the license if they're not registered. Thank you, Madam Chair.
Okay, so that's in the future, not in this bill immediately.
Not as it is written now.
All right. Thank you very much. Mr. Nadeau. Chief Nadeau.
Oh, thank you, ma'am. Jeff, wasn't there provision within the current regulations of Pdmp of there is some kind of penalty provision if the prescriber doesn't, or those registered do not adhere to it? Could you share with us what that was exactly? Because I know there is some language about penalty.
Yes, it's in the rules and regs. It's just stating that and I think it's the same clause that we have in the bill, the current bill, but just saying that the department may pursue the suspension or revocation of the registrant CSR in accordance to 67.304 of the Act for violating terms of these rules and regulations, and may be subject to disciplinary action by any applicable government entity. So
right.
That's
so
there's no specific.
Right. So there's I guess I'm not a lawyer, so I'm not going to pretend to be one. But so if this bill is approved and passes, it's approved, it's a possibility that that provision may allow us to actually pursue, because it says may, if they don't comply. So I think that might apply in terms of the penalty provision if they do not register.
All right. Thank you.
But
Dr.
just to be clear, Madam Chair, this is a may option. It's not a shall option. And so it's not a definitive action forward. It's something that perhaps that, Chief, if there's you see a significant, or you're alerted by DEA, a significant abuse to prescribing the medication, then it is something that that they can consider to pursue. But it's not a requirement that there will be this definitive quantitative fine on top or consequence.
All right,
Yes,
thank
thank you.
Dr. Weir.
Thank you for allowing me to speak again. I was particularly touched by Mr. Schiff's testimony. And I think hopefully some of his questions have been answered. The problem with waiting for reports, I think, is very easily handled in that hopefully this is not something that the physician is required to do in terms of getting reports, but his office is able to get those reports. And if that's not available, it needs to be made available. Ideally, as I could foresee this system, if a patient comes in who is on opioids or foreseeably may need opioids, that report could be generated and placed on the chart prior to the patients actually seeing the physician. So hopefully that concern can be allayed. In terms of cost, I think that's a reasonable concern for the system, but we do have fees that are charged now in order to prescribe controlled substances. And that fee is ridiculously low, in my opinion. And adding, money to that fee is one source of revenue that could cover any costs. I would suggest that we talk with the pharmacy board who have been dealing with this all along and make sure that the program that they're using is acceptable and workable. And I think that we do need to talk to the other boards of people who are involved. And I did neglect to mention that dentists are one of those people. In terms of Mr. Schiff's concern that physicians may not want to prescribe these drugs, I think that's a real concern. And certainly in my experience in working with public health, there are a number of doctors who basically have said, I don't want to be involved with this for, I think, understandable reasons, because these patients, when they abuse drugs, can be very trying. And I can see that this might be a real concern in terms of limiting the numbers of providers who provide drugs. But I think that can be worked with. Finally, in terms of education, I think that it's a fairly simple matter to acquire CME credit for any presentations that the Drug Administration feels need to be presented. And I think that will help offset any concerns by physicians to acquire the knowledge to operate in the system. I continue to feel that this bill as written is not acceptable, and that it should be tabled with the timeline. I would suggest 3 to 6 months, certainly before this legislature ends its session, to come back with a new, cleaner bill. Thank you.
Thank you, Mr. Weir. Senator Nelson, did you have any further questions? Should I? Okay, Senator Torres, you're recognized.
Madam Chair, I don't have any questions. I just want to thank everyone for their testimony today. It certainly provided a lot of background information. And for the most part, am pleased with the revisions to this bill, which addresses all the concerns from a prior version that that I thought were not going to allow such a thing to move forward. But I'm pleased with the way this bill has been presented and with the testimony today. Thank you very much to Public Health and also to Behavioral Health for your testimony, which was very insightful as well. Thank you.
Thank you, Senator. Legislative Secretary Shelton, you're recognized.
Thank you very much, Madam Speaker, and thank you to all those who are on the line today to testify on the bill and to help us strengthen this measure and move forward. Most of my questions were answered as well with all of the discussion from the testimony. I would like some clarification from Mr. Pinaula. You mentioned another report that takes a time of 2 weeks for prescription upload. Can you tell us the difference between that report and the report that is automated as soon as you type in the patient's name? What is the difference between those two reports?
So the report that takes, it doesn't necessarily take 2 weeks. It's just our reporting requirements for pharmacies to upload the prescription information into the database. That way, the patient's prescription history is updated. The report that the physicians generate is the patient report of the prescription information uploaded by the pharmacies on every 2 weeks.
And during that 2-week period that is allowed for pharmacists to upload the new prescription information, does that in any way hinder a prescriber, a physician, from making the necessary, taking the necessary action for their patients, prescribing any medication?
No, it doesn't. They can access the report at any time they need to.
Okay, thank you very much. And there was discussion about allowing for both the pharmacist and the prescriber to input the information. And is there, in the program itself, does it take care of any potential issue that might arise from duplicating a prescription?
So this is where we only allow the pharmacies to upload. That way there is no duplicate prescriptions entered into the system. So all the prescription information is uploaded on the pharmacy's end. We're not requiring physicians to upload prescription information because their prescription may not even be filled. You know, the patient might just take the prescription and not fill it. So that's why all that information is uploaded by the pharmacist.
Okay, so to be clear then, public health does not support allowing the prescriber to also input the information.
Correct.
Okay, thank you very much. Thank you, Madam Chair, for the opportunity and for allowing us to discuss this bill today. I think it's a really important measure for us, adding to the toolbox of prevention that we have been trying to build up upon in this term and the last term. So I look forward to this bill moving forward. Thank you very much.
Thank you, Senator Shelton. Senator Anthony Ada.
Thank you, Madam Chair, Madam Speaker, and thank you to everyone who came to testify today on this bill. I understand where Dr. Weir is coming from on looking to at least have an additional roundtable discussion or an additional public hearing, Madam Speaker, would probably, get all those that haven't had the opportunity to come today to testify in the bill, physicians and pharmacists alike. I understand there was an email that I received from Dr. Berg asking to postpone the hearing, but I'm glad we moved forward with the hearing, but perhaps additional roundtable discussions or additional public hearing prior to the bill being reported out of committee. And like Mr. Schiff said, he's surprised that there weren't more physicians or pharmacists here on this Zoom. So that's the only concerns I had, is to address that and see how we can move forward with this. Thank you, Madam Chair.
Thank you, Senator Ada. And I want to state for the record that the committee has received no such email from Dr. Berg requesting that this hearing be postponed. In fact, it was set previously and postponed for a little while, but yeah, Public Health is anxious to get this bill moving. So thank you, Senator Adams.
Thank you, Madam Chair, for that. And, it was addressed to Director Sinagustin and Administrator Pacina. So
Okay, thank you very much.
I'm not sure whether you had it. Thank you.
Senator Taitigui.
Thank you, Madam Chairman, and thank you to everyone who's here testifying, especially to Public Health, because it would be your agency that would monitor this. And it's good to hear that the cost associated with this legislation would be taken care of via two options: the federal funding that you mentioned, and also another funding. I believe it's a revolving fund, if I'm not mistaken, Tom. Okay. It's one thing to have federal funding, but once that federal funding ends, what do you do then? So I'm glad there's a second alternative. However, during the 35th Guam legislature, a similar bill, Bill 388-35, was also introduced and had a public hearing on November 30th, 2020. There was quite a bit of physicians who attended that: Dr. Berg, Dr. Mayumi, several other doctors. I think Dr. Schiff, you were there as well in that public hearing. There were a lot of issues that were brought up and concerns. That's why I'm kind of taken back why we don't have more physicians here to address some of the concerns that were brought not only in Bill 6 that was introduced prior, a similar Bill 636, but as well as 388-35. However, I do have a question, Tom, or Jeff, if you can, since you're running the program. This program is basically only for pharmacists to submit information on this data bank, correct? I mean, physicians don't fill out any forms if they were to prescribe any medication, opioids to be exact, on this form. Is it just physicians? I mean, just pharmacists?
Yes, that is correct. Currently, the only party responsible for uploading the information are the pharmacists of those prescriptions that they receive, honored in the drug dispense. So that information comes from pharmacists. Only pharmacies, not from the prescribers.
Okay, so, and we did get some information from some pharmacists with regards to this. So this does not affect physicians at all, right? Just to get the information. Is that right, Tom?
As we spoke earlier, yes, Senator, all they simply need to do is obtain the information of the patient's dispensing history.
And that's what currently happens right now with public health based on the Guam, let me pull this up. The GAR, the rules and regs, that's what's currently being done right now. So what's the change?
The difference is now we're requiring the prescriber to register with us and seek the information. Currently, it's an option based on a couple of criteria, but this passage of this bill would require them to actually access the information about the patients.
Okay, so it doesn't require them to fill out any documentation when prescribing medication. However, they have to pull up the data bank when prescribing and attach that to their, or just review that before prescribing. Is that what this bill will require physicians to do, or the prescribers to do?
Well, what it does is allow the prescriber to have a history of the patient that they plan to write prescription for, to ensure, to get the history of the individual's prescription the drug that he receives, so he or she can make the right decision in terms of the patient care in respect to controlled substances.
Okay. But it doesn't require the prescriber at all to fill out any information or to do anything different what's currently being done right now, other than just to review the data before prescribing these types of drugs.
In the nutshell, that is correct, Senator. They just simply have to access the information.
Okay. Do prescribers who prescribe this kind of drugs, are they require, oh yeah, it was mentioned that if they do prescribe these type of drugs, they have to be registered. So that one, is already taken care of. So yeah, okay, other than that, Madam Chair, I don't really see any other issues. My biggest concern was just the funding that public health is going to need to implement this. But right now they currently do that already. This isn't a bill that just a matter of, those who prescribe these drugs just have to go on and look at the data before prescribing it to make a good decision on prescribing it. It's as simple as that. So other than that, Madam Chair, thank you so much.
Thank you very much, Senator Taitigui. Senator Dueñas, Minority Leader.
Titus Masi, Madam Chair, and I join my colleagues in thanking everyone who's appeared today on this very important measure. Obviously, it deals with, an issue that has become widely discussed nationwide, I think, and certainly is appropriate to be discussing it here on the island. I'm going to continue to become educated on the subject matter and listen going forward. That's my purpose mainly today. I don't have any questions, but it's been very enlightening in terms of the questions and answers that has been going on. So I'm going to continue to listen and learn more about what this requirement will be doing going forward. And I think I've got a handle on it, but this is certainly out of my realm of understanding. So I'm going to continue to become educated on the matter. Thank you, Madam Speaker. Titus Masi.
Titus Masi, Senator Dueñas. Senator Joanne Brown.
Thank you very much, Madam Chair. Certainly in listening to the discussion and presentation that has been made this morning with regards to this bill. I guess we'll just have to find out if there are any additional concerns or hurdles that others in the medical community may have with regards to this. I think we can understand the intent is to ensure that these type of controlled substances essentially are being watched, so to speak, because obviously we've heard of circumstances where individuals that get addicted to these type of controlled medication that they may have initially received for an injury or whatever the case may be, become addicted to it, and then perhaps go to different doctors who may not obviously be communicating with each other and are simply looking at the individually at the patient and not maybe realizing that that individual may be out going to other doctors to try to get additional controlled substance medication because they're addicted to it. So I think we understand that and the need to obviously have a layer of review to ensure that there is no abuse or that you don't have a physician that's really administering an awful lot. And we've heard of cases in the past that have come forth before the court system where we've had medical physicians actually that have been giving an excessive amounts to certain patients. For whatever reason. I mean, you can wonder, and of course your imagination can take you in different places, but I certainly would want to hear to make sure there's no major issue in implementing it. I certainly understand the concerns by the doctors that, their busy day taking care of a number of patients that you don't want to make this process too laborious for them. But certainly if this is something that can be implemented at the point of dispensing of the medication with the pharmacist, then certainly we can understand the need to do that. And I'm open also, as some of my colleagues have mentioned, to further discussion with regards to this bill. And I think there might be a need for just a little more input before we put this bill on the floor, perhaps further discussion or a roundtable and get more input from the medical community that would be actually charged with administering this law, should it be put in place. With that, Madam Chair, I have no further comment or questions.
Thank you very much, Senator Brown. Before I hand it to the sponsor for a closing statement, I want to check public health. So we invited the Guam Medical Association and the Guam Medical Society to invite its members to also give testimony today. But I want to know, is Public Health been notified of any objection to this bill from Dr. Berg or the Board of Medical Examiners?
I can only speak for the Division of Environmental Health, Speaker. We have not received any concerns or issues from any of the physicians on Island Mail.
All right, and Mr. Schiff, if you could clarify, someone referred to you as Dr. Schiff, so my apologies. If you could just give me a little bit of your background. You were listed as patient advocate for Guam and the CNMI. Could you just explain that, please?
Yes, I'm not a physician. I'm just a patient myself and an advocate for other patients to make sure we keep the doctor-patient relationship as strong as we can without, being a watchful eye from outside. Just 2 quick points I wanted to make. If, why haven't the doctors got on board? This program's been around for many years, and only 65 out of 381 prescribers are utilizing it or have registered with it. There's something going on there that doesn't make sense. If it's as simple as everyone says, you get the reports instantly, why does the bill say you'll receive the report either by phone, facsimile, or email within 24 hours, quote unquote? So you're kind of confusing. I hear one physician saying, oh, I get it right away, but yet why is the bill giving that perception? So if we don't get the doctors on board, we're going to see a lot of problems. Thank you all.
Thank you. And again, thank you to all of you who've testified. Senator Nelson, you may close on the bill.
I just have one question, if I may. I'm sorry.
Thank you, Madam Chair. If I may, I would like to ask a couple questions before I make my closing remarks.
All right, Senator Nelson, do you mind if I let Senator Taitui ask her one question? Senator Taitui.
Madam Chair.
Okay.
I do not mind.
Thank you, Senator Nelson, and thank you, Madam Chair. My question earlier that I asked, it was only the pharmacists that have to provide this information when anytime a prescription was, they gave out a prescription, right? But it doesn't require the doctor to also provide information on this data bank that they prescribed it. Tom, you mentioned that it's just the pharmacist, but does this bill require now all doctors, when prescribing any type of opioid, that they also incorporate that into the data bank?
I do not believe so, because there are language in the current regulations for Pdmp, and Jeff, correct me if I'm wrong, that mentions the pharmacists, right? Jeff, that the one who are to upload, not the prescribers.
And this bill would not change that?
It's my understanding it does not. Am I correct, Jeff?
Okay, I just wanted to verify that. Thank you so much. Because I'm getting confused thank you so much. And thank you, Senator Nelson, for the opportunity for one more, just to clarify. Thank you.
Thank you, Senator. Madam Chair, may I?
Yes, please, Senator.
Okay, thank you. Chief Nadeau, just in the most simplest terms, right? I think I'm hearing that there is some concern that if the pharmacies are doing it, then why is it even important for the doctors to do it? How does that impact the community or the process moving forward if the pharmacies are already doing it? Can you explain the importance of the prescription drug monitoring program and why it is beneficial for doctors, the prescribers, to register with this program?
Right. So we can look at this from the public health perspective as well as the law enforcement. From public health perspective, as I commented earlier, prevention is a key, and everything starts with the physician because he or she is the one that writes a prescription that allows the individual to get controlled substances. If the doctor is aware of the prescribing pattern or history of the patient, then he or she can make a determination whether the amount, the quantity, the type of drugs should be given to the individual. The pharmacist, they're primarily responsible for dispensing based on the order of the prescriber. They're not the one who's practicing medicine per se. They simply honor the prescription, but they have a responsibility to ensure that the drug that they are dispensed are not for unlawful purposes. And that's one of the reasons why they also look at the history, because if there's a concern about doctor shopping, they can bring it up to the doctor's attention. But the key is prevention before it even reaches that level, because it's possible that the drug may be dispensed without the knowledge of the pharmacist of potential doctor shopping or diversion of other kinds, if you will. And from the law enforcement perspective, we don't want it to get that level. This is a public health system, but it is available for law enforcement for their tool. But as I mentioned, it's only if there's a legitimate investigation. They cannot just simply use the tool of the system as a fishing expedition. So key is prevention and also, monitoring the patient, because the doctor can also educate and not simply treat the individual if there is a potential abuse or addiction going on. So it's the key, and I hate the word, use the word over and over, but prevention is the key, Senator. And I think this is a first step in having the prescriber monitoring the patient to ensure that there is no potential for that to occur. I know that was a long-winded sentence. I'm sorry.
Thank you. And can you just make some comparisons to the states that have implemented these registration requirements with additional reporting requirements, the functionality of how it would compare to Guam currently that we don't have the same requirements?
Right. I'll let Jeff take that one, because I know he was gathering data and he's got training and information from the national data. Jeff?
Thank you, Chief. Thank you, Jeff.
Thank you. So currently, we are using a system by a vendor called APPENDIX, and they provide the same system to over about 42 other states and territories. And I think based on the description in the bill about Guam is one of the few territories that does not have mandatory registration requirements to use the Pdmp. Most other states do. And as mentioned before, there are some states that take it a step further where it's part of their licensing, or there is a fee or some sort of penalty if they do not register. I hope I answered that question.
Thank you, Jeff. Thank you, Madam Chair, for allowing me the opportunity to address some of the other concerns. Just real quick, Madam Chair, there was a concern also that there's not that many physicians here in this Zoom hearing. However, we have reached out to them. Public notice was given. We have also, since the submission of Bill 6, and we had that hearing, we have had numerous meetings with healthcare professionals to come to this point to create Bill 168-36. So this was with their input and working with them that we came to this point. However, Madam Chair, we are still collecting testimony. And so we look forward to hearing whatever else that may come in relation to Bill 168-36. That's all I have at this time. Thank you, Madam Chair.
Thank you very much, Senator Nelson. And Mr. Nadeau, you had sent me an inquiry not too long ago asking when we are going to proceed with this hearing. Do you believe this is an urgent matter, or should it be postponed?
Oh, Speaker, you're putting me in a spot here. We've been communicating with, working with Senator Nelson for some time now. I honestly thought this would be up for discussion earlier, public hearing. We're kind of surprised it got delayed, but we're looking forward to its discussion that we're having now and hopeful passage. So I'd like to see it addressed as soon as possible, but I do understand that we'd like to have the consensus of the community to get this passed, but we'd like to see it passed as soon as possible.
All right. Because apparently there's been an email sent to the Director of Public Health, to Zenia, who is the chair of the Health Professional Licensing Office at Public Health, from Dr. Berg, dated January 18, 2022, asking that I'm just getting a copy of this morning from Brianna Sablan at Public Health. It's been forwarded to me. This was not provided to the committee prior, but I'm going to read it because I just think, Public Health, they did not notify me of this, yet they have asked me to proceed with these hearings. So they say, please request from the, Dr. Berg says, please request from the speaker that all non-emergent healthcare related legislative issues be postponed until after our public health emergency is declared over. That is, all non-emergent issues should be postponed if they should have input from the healthcare community, as they can't expect adequate input during a public health emergency. I'm quite surprised by that testimony, but we will take that into consideration, and I will discuss this with the sponsor of the bill, of course, and with public health. And I think that that such information should be forwarded to the committee if public health wants the committee to consider that type of thing, and not in the middle of the hearing. Thank you. Senator Nelson, please.
Madam Speaker, I take no issue with postponing and moving forward until after the state of emergency is removed. So if that need be, then that is fine with me.
Thank you, Senator Nelson. So, Mr. Nadeau, did you have your hand up?
Oh, yes, ma'am. Thank you, Speaker. I'm not aware that letter you received, so I can't speak on behalf of the Director in the Department, so I'll reserve my comments on that. So thank you.
All right, thank you. There being no additional individuals to present testimony, the committee.
Sorry, Madam Speaker.
Yes, Ms. Sablan.
Brianna, my apologies. I was not aware of that email. I had just gotten it this morning. The moment I sent it to you, Dr. Berg is on the chair for the Guam Medical Examiners Board, and I was not copied on that email. So my apologies for not forwarding it in advance, but I sent it as soon as I got that.
Yes, thank you very much for doing that. Thank you. So there being no additional testimony, this committee will consider Bill 169-36 LS duly heard.
Oh, sorry. Can I do? Oh, can I just one last comment?
Oh, Ms. Gabriel, yes.
Yeah, just again, I do agree with doing this bill and requirements for registration, but I think the wording needs to be changed because of those engaging in the practice of dispensing. We should just change that to licensed pharmacists only. And then again, removing administrators, because that may also include caregivers, right? Or even others that don't have license.
We understand your input, Ms. Gabriel. We are working with legal to make sure that the wording is correct and addressed your concerns in your earlier testimony.
Perfect. Just wanted to make sure.
Thank you very much. So there being no additional testimony, this committee will consider Bill 168-36 LS duly heard, and we will move on to the next item on our agenda, which is Bill number 169-36 LS, also introduced by Senator Nelson. And I would like to ask Senator Nelson to please introduce that bill.
Thank you, Madam Chair. Bill number 169-36 LS is an act to amend Appendix A, Appendix B, Appendix C, Appendix D, and Appendix E of Chapter 26, Title 9 of Guam Code Annotated, relative to updating the list of scheduled controlled substances provided in the Guam Uniform Controlled Substances Act. The intent of this legislation is to properly update the list of scheduled controlled substances to reflect with federal regulations provided by sections 1308.11, 1308.12, 1308.13, 1308.14, and 1308.15 of Title 21 of the Code of Federal Regulations relative to schedules of controlled substances. Pursuant to Chapter 67 of Title 9 of the Guam Code Annotated, DPHSS has the authority to administer this act and to add, delete, or otherwise update appendices A, B, C, D, and E in accordance with Section 67.201. The continued health and public safety of our island residents necessitates a unified legal framework that regulates the use, dispensation, and categorization of controlled substances. With Bill number 169-36 LS, it updates Schedule 1 through Schedule 5 of controlled substances based on their medical utility and potential for dependence or abuse. Thank you, Madam Speaker.
Very much, Senator Nelson. I'd like to acknowledge the presence of my colleagues, Senator Nelson, Senator Mary Torres, Senator Amanda Shelton, Senator Anthony Ada, Senator Telotitagui, Senator Chris Duenas, and Senator Joanne Brown. Thank you, colleagues. We'll now proceed with testimony, beginning again with Masatomo Nadeau, Chief of the Division of Environmental Health, Department of Public Health and Social Services. Please proceed, Mr. Nadeau.
Thank you, Speaker. Half-day Speaker, Health Chair Therese Terlaje, Senator Telena Nelson, and members of the Committee on Health, Land, Justice, and Culture. I am Tom Nadeau, the Chief Environmental Public Officer with the Division of Environmental Health, excuse me, Department of Public Health and Social Services. On behalf of our Director, Arthur San Agustin, I'd like to thank you for allowing the department to present its testimony on Bill 169-36 relative to updating the list of schedule controlled substances provided in the Guam Uniform Controlled Substance Act of Title IX, Guam Code Annotated, Chapter 67. Before I begin, I would like to just first point out that there's a typographical error in the chapter numbering in Bill 169. The correct chapter should read 67, not 26. Thus, Bill 1693-6 should read to amend appendices A, B, C, D, and E of Chapter 67 of Title IX of GCA. The Department of Public Health and Social Services supports Bill 169-36. As you may know, the Division of Environmental Health of this department administers the Guam Uniform Controlled Substance Act and is mandated by Section 67.301F of the said act to update the controlled substance schedules pursuant to the Administrative Adjudication Law. The schedule listing of controlled substances was last updated on September 30, 2011 via Public Law 31-110, and thus it is due for an update, and Bill 169-36 will address that need. The passage of Bill 169-36 will properly align Guam's schedule listing to mirror those of the U.S. Drug Enforcement Administration under their code, Federal Code of Regulations, Section 1308. We support the following changes that will update the controlled substance schedule as proposed in Bill 169-36. I don't know if you'd like me to, but it's on the written testimony there of the some of these are difficult to pronounce, and I hate to butcher these words, but definitely for Schedule 1, Appendix A, there are a total of 15 new opiates, 43 hallucinogenic substances, and 22 temporary listing of substances subject to emergency scheduling that added to Appendix A. A total of 14 cannabinoid agents were reclassified as hallucinogenic substances, and 12 were deleted from Appendix A. And for Schedule 2, which is Appendix B, opium and opiate were added to Appendix B. Schedule 3, which is Appendix C, narcotic drug and steroids were added to Appendix C, as well as the deletion of a couple of the anabolic steroids. Schedule 4, requesting some changes as well, such as narcotic drug to be added, and as well as one that was deleted. Schedule 5, a total of 4 depressant drugs were added to Appendix E. So after almost a decade, it's crucial that the list of scheduled drugs be updated and aligned with DEA. Not only will this benefit our law enforcement officers, the Attorney General's office, but also medical practitioners in treatment of their patients. The department would like to thank you, Speaker, and Senator Nelson for assisting us in sponsoring this important legislation. Thank you.
Thank you very much, Chief Nadeau. Is there anyone else on behalf of Public Health who would like to testify? If not, then we'll proceed with Dr. Weir.
Thank you, Senator Terlaje. I think this bill is long overdue and is basically the administrative matter that public health should be able to do on an ongoing basis. The one problem that I see is that Guam's laws and the DEA's pronouncements differ widely when it comes to marijuana. And we need to make sure that any local rules apply here. I can see some other drugs that could have equal problems in the future. I don't think we need to discuss those now, but there needs to be some flexibility built in. Thank you.
Thank you very much, Dr. Weir. Is there anyone else who'd like to testify? I don't see anyone. I'd like to recognize the presence of Senator Sabina Paris, who has joined us. And I'd like to note that we have a fiscal impact note from BBMR, which states that the bill is administrative in nature and poses no fiscal impact upon any of the funds of the government of Guam. Mr. Nadeau, or Chief Nadeau, could you please confirm that for the Department of Public Health, that there would be no fiscal impact?
That's correct, Speaker. We're not anticipating any kind of additional fee or any kind of financial challenges in the adoption of these regulations or this bill. Thank you.
All right, thank you. And I want to note for the record, we just received immediately prior to the hearing that legal review, which states that some of the citations in this bill need to be corrected, as Mr. Nadeau stated earlier, and there are additional ones where the existing code sections are not reflected properly. So we will have to ensure that that is done. And so my only question is the treatment of cannabis. Mr. Nadeau, if you could explain, how does this bill affect that?
My understanding, it does not. There is no reference to cannabis, cannabis sativa, the plant of marijuana. This addresses the other controlled substance that are not on the local listing, that's on the federal listing, Speaker.
Right. Okay. Just wanted to make sure we're still consistent with our other laws, right? So locally, this will not add any of that. All right. So Senator Nelson, you're recognized.
Thank you, Madam Speaker. Yes, I wanted to make that comment that this bill is not inclusive of cannabis. So it's not conflicting with our current local statute. And we did receive the response back from legal for the technical changes onto the bill. However, the content still remains. That's all I have. And thank you, Chief Nadeau, for being present again, and Jeff and Dr. Greer. Thank you for being here.
Thank you, Senator Nelson. Senator Torres, you're recognized.
Thank you. I have no questions or comments to this bill. It is administrative in nature and long overdue, so I certainly support it and thank the author for bringing it to our attention. Thank you.
Thank you, Senator Torres. Legislative Secretary Shelton.
Thank you very much, Madam Speaker. I have no questions or comments for this bill other than to thank all those who are here today to testify to contribute to this public hearing. Thank you very much.
Thank you, Senator Shelton. Senator Ada.
Thank you, Madam Chair, Madam Speaker. I have no questions. Just like to thank everyone again for their testimony on this bill, and I look forward to having this bill move forward on our session. Thank you.
Thank you, Senator Taitakwi.
Madam Chair, or Madam Speaker, for the opportunity. And again, thank those who are here today, Tom, especially Public Health, for being here and testifying, as well as others, Dr. Weary. And I hope this bill does not have any kind of delay, as the other bill that was mentioned from other physicians to hold off on it. This bill doesn't need that type of delay. So I'm looking forward to moving forward as expeditiously as possible. Thank you so much, Madam Chair, for the opportunity.
Thank you, Senator Taitakwi. Chief Nadeau, could you please confirm on behalf of Public Health whether you believe this bill needs to be postponed?
No, I do not believe this bill needs to be postponed. Thank you.
Thank you very much. Senator Duenas, you're recognized, Minority Leader.
Madam Chair, and I just share the comments by my colleagues. Thank you for those who have appeared today and look forward to supporting this bill going forward. Madam Chair.
Senator Brown, you are recognized.
Thank you very much, Madam Chair. I really don't have any comment. I think the presentation has been relatively straightforward with regards to updating these listings for these controlled substances, and certainly also concur with our colleagues in thanking the members of the panel from Public Health and our physicians that have participated and contributed their input with regards to Bill 169. With that, I have no further comment. Thank you.
Thank you, Senator Brown. Senator Sabina Paris.
Thank you, Speaker, and thank you, Madam Chair. Yeah, no comments, except that I do appreciate the work that went into this to make sure that it's up to date with the federal regulations, considering a lot has changed in the 10 years. So, to the sponsor. Thank you. Thank you, Madam Speaker.
Thank you, Senators. Senator Nelson, you may close on the bill.
Thank you, Madam Chair. I just want to thank the DPHSS team for working with our office. It took us several months to make sure that we had the correct substances and their spelling right. So thank you for vigorously working with us to get this updated into our current statute. And thank you for all the hard work you've been doing throughout this time and the pandemic.
Thank you. You're welcome, ma'am.
Thank you, Senator Nelson. There being no additional testimony, this committee will consider Bill 169-36 duly heard. The committee will remain open for submission of additional written testimony on Bills 168 and 169-36 for the next 10 working days following the hearing, that is until February 2, 2022. Testimony can be sent via email to Senator Terlaje Guam@gmail.com or hand delivered here to the Congress building. Public hearing is now adjourned. The time is 10:51. Si Diyos ma'asi todos.